Thank you for having me. My name is Meredith Tekin. I'm the president of IBCCES, and I'm excited to talk to you all today about advocating in your community for law enforcement and first responder training. So just a little bit about IBCCES. My organization is the International Board of Credentialing and Continuing Education Standards, and we have a variety of training and certification programs for professionals who work with individuals that might be autistic or have other neurodiversities or cognitive differences. So we do offer a program for law enforcement and first responders, and we're based here in Florida, but we work all over the US and all over the globe. And so we have personal experience working with first responders and law enforcement, helping them to better understand and manage those interactions with folks in their community that might be autistic or have other differences. But we also work with healthcare providers, educators, and other professionals as well. So a little introduction about what I'm going to talk about today. Many law enforcement and first responders do not receive sufficient training in this area. So they may not get a lot of training on how to approach individuals who might have those differences and maybe sensory needs or sensitivities. They really don't get a lot of training unless their department specifically has a focus on making sure that they receive that information. So we're going to talk about the who, what, why, and how of autism training for first responders in your community. And I know that many of you probably have varied backgrounds. So we are going to go over a few basic things first, just to set the stage, and then really just dive into how can this help and hopefully share some information that's useful to you so you can use that information as talking points in your own community when you're advocating to provide this to those first responders or law enforcement in your area. So we want to empower you to do that. And if anybody has any questions, feel free to contact me. The last screen will have my information, so you can send me an email if you want. But basically, let's start with who does this affect? So 1 in 54 children is diagnosed with autism in the United States. We'll talk a little bit more about that. But as far as the wide variety of individuals that can benefit from having better interactions with law enforcement and first responders, 1 in 54 children is formally diagnosed. We do know that 1 in 6 people have a sensory disorder or sensitivity. So obviously autism does have a sensory component, but that could include a wide variety of other differences, needs, mental health, PTSD, other disabilities as well. We know that there are millions of adults in the US that were never diagnosed or were diagnosed maybe later in life. So there are folks that are getting diagnoses in their 40s and 50s. And so again, they may not have that language to say that they have those needs, or they may not have a lot of support needs, but they still might react differently or communicate differently. And so law enforcement and first responders really need to understand that. And then we also know that along with autism, there are many other commonly co-occurring conditions. So when we look at how can we have better interactions with first responders and law enforcement, mental health, of course, comes into play as well. Folks that are in crisis or maybe have anxiety. Anxiety is a commonly co-occurring disorder with autism, as are sleep disorders, ADHD, and others. So again, when we're looking at how many folks in the community does this impact, it is a large number of people. And I think that that's really important to share with professionals, especially those that might not have a lot of personal experience unless they have a family member or a friend that has those differences. It's just sometimes hard for them to just understand that this impacts a large number of people. And of course, 1 in 4 adults has a disability. So whether that be mobility related or cognitive related, we know again that this is a huge portion of the population that generally, unfortunately, isn't really put into the forefront when organizations are looking at training or services. A little bit more about the diagnostic rate. So again, we're looking at 1 in 54 in the United States, which is the tracking number that's released by the CDC. According to World Health Organization, we know that about 1 in 160 children worldwide is diagnosed with autism, but that can vary greatly depending on where you're located, what your access to services are, and how that country or region reports those numbers. So in general, when we're talking about diagnosis rates, usually those are pretty conservative as far as how many individuals are impacted. So again, if you live this day to day, you might already be aware of that, but these are things that most folks that don't have personal experience, they just don't know or don't understand. So this is good information also if you're advocating for a service in your area. We also know that everybody doesn't have access to diagnoses, so they might decide not to pursue diagnosis, or they might be missed. So we know that a lot of girls in particular are missed or underdiagnosed or underrepresented in those numbers when we're talking about autism specifically. Same goes for adult women. We also know that Black people and people of color, Indigenous folks are also typically underrepresented in those diagnosis rates. And we also know that some individuals might have reduced access, whether that be because they might not have the financial means to pursue a diagnosis, or maybe they reside in a rural area. They might have to drive 2 or 3 hours to see a specialist or an individual that can help them, with support services. So again, when we look at the statistics, they're compelling numbers, but we also have to remember that those numbers don't tell the full story. So again, trying to break down those myths and build empathy and understanding, it's important to share this type of information so that folks that don't have that personal experience or don't know the impacts can really get the full picture. And once you present it in this way, it becomes undeniable that this information and training and a larger focus needs to be made on this segment of the population. So why is this important? Again, if you're in this space, if you are autistic yourself, or you might have a child or someone that is in your family that's autistic, you probably already know this, but these numbers are pretty staggering. So approximately 1 in 5 adolescents with autism will be stopped and questioned by a police officer before they're 21. So that's a pretty big number. And then again, that's just what's tracked. Individuals with disabilities, including autism, are 5 times more likely to be incarcerated, and injuries and fatalities during police interactions are disproportionately common in this population. So again, for whatever reason, individuals that are autistic or have other differences have more encounters, are very likely to have an encounter, and that encounter might not turn out in a very positive way. If that does happen, that situation might escalate. So it's really important, again, to share this information and to let this be known. And it's not saying that obviously because you're autistic, you're more likely to commit a crime. It just means that those interactions might not turn out to be a very positive one. And there are also some things that might make that individual more likely to interact with law enforcement or first responders because of some behaviors or other differences. So why is this important? So elopement obviously is a big issue. Stimming or other non-typical behavior. So again, this just might cause someone to call the police or think someone's in distress or think that they're doing something unusual when really they're not and they're okay. Individuals that have these differences might also not respond to verbal commands, or they might not understand expectations in certain scenarios. They might have a meltdown, they might have sensory overload, they might get overwhelmed. Again, especially in a first responder scenario where it's already a very tense situation, maybe they need medical care, maybe they need assistance, but they're already overwhelmed. And then if that first responder doesn't understand how to engage or interact or understand maybe what are those signs, they can definitely make the situation worse. And then again, non-typical behaviors as far as social standards and expectations and how do you engage with other, community members, friends, residents, neighbors, things like that. So all of those factors can contribute to those statistics. So we know that elopement is a common concern for individuals with autism or other differences. In one survey, 49% of respondents said their child had attempted to elope at least once by the age of 4. 26% of those were missing long enough to cause concern, and a large percentage of them were in danger of drowning. We know that drowning is one of the leading causes of death, unfortunately, for autistic individuals, and 65% of those were in danger of a traffic injury. So an individual might elope or wander because of other needs. They might get overwhelmed, and then they might try to elope or escape that area because of the sensory overload. But we know this is a huge need. So when that happens, law enforcement or first responders might be involved. And then again, statistically, that just increases the chances that this person is going to interact with those professionals. We also know that stimming or other what we would call non-typical behavior can increase likelihood of misunderstandings. Law enforcement could be called unnecessarily. There's videos and situations that have been shared in the news media about individuals that really weren't doing anything wrong, but someone thought that they were doing something that was not appropriate, or they just didn't understand the behavior, so they called the police. The police showed up, and again, because of communication differences or that officer not being trained to really treat that individual differently, they thought the person was on drugs or the person wasn't compliant, And that really can escalate a situation quickly, unfortunately, which is not what we want to see. We also, again, know that not responding to verbal commands or maybe not understanding what those commands mean or what they're supposed to do can also cause first responders or law enforcement to escalate situations. So a training program that can be helpful needs to focus on de-escalation, on early identification. Everyone's safety comes first. So of course there are situations when, things just need to be done. But in most cases, taking a step back when you first enter into that situation as a first responder or law enforcement professional can really make a big impact in the outcome of that scenario. And then misunderstanding social cues or non-typical behaviors could cause friction or misunderstandings with other community members. So for example, you might see, court cases where an individual is accused of stalking another person or invading their privacy or maybe acting aggressively. And again, the person that's being accused might be autistic and they might not know that that behavior is not welcomed or not acceptable. And that can also cause problems as well. And again, lead to those statistics as far as incarceration and really at an early age, kind of having those run-ins with law enforcement. Also, from a first responder standpoint, there are a lot of impacts as far as treatment. So it can cause misdiagnosis. So individuals that are on the spectrum might communicate their symptoms differently, their pain differently. They might not be able to specifically say where they're hurt or how much pain they're in, or they might just do that in a different way. They also can get overwhelmed. So if someone touches them or grabs them, is trying to perform a physical exam or trying to assist them, again, safety first, that person might need to get out of that situation pretty quickly. But if a first responder doesn't know to approach individuals in a certain way, they can definitely cause that person to get overwhelmed or maybe cause a reaction that they didn't intend. And then that can just prolong that situation, maybe make it more dangerous, or maybe just have an outcome that isn't helpful to the ultimate treatment of that person. We know that it can also cause treatment delays. It can extend the time, for example, for intake or exams or figuring out how to help that person. And again, if staff isn't aware of how to work best with that individual, they're not going to be able to provide the best care. We also know that communication is a barrier. So again, we want to train professionals on how to communicate and understand folks that maybe communicate differently than they do. And that can impact, again, when you're trying to ask questions about a person's pain or injuries or what happened, what was the situation right before the incident, that just can be really difficult. And most individuals or professionals that are not familiar with autism typically think of autism as being something that a child has. And again, not considering maybe that adults might be autistic as well, or might be on the spectrum, or they may take that adult differently than a child as far as their behaviors and actions, when really they need to just approach them with some empathy and some understanding as well. So usually it's just myth busting and taking a step back and approaching the situation differently that can really change those outcomes. And all this information is information that a lot of healthcare professionals and first responders really aren't aware of, unless they're a specialist, unless they're a therapist working with autistic patients, or unless they have personal experience. A lot of professionals just don't consider this in their day-to-day, and they need to be educated on the needs and the differences so that they can be aware that there's education that they need to do for themselves to have a better outcome, which ultimately is what everybody wants, but they're not even aware that this is a blind spot. So this is an example. This is just taken from a news story, but for example, there's a story about a police officer named Brett Baker who was attempting to stop a vehicle because of a minor traffic violation, but the car didn't pull over. So he had his flashing lights on. He continued to follow the car, and basically the car pulled into a driveway and the driver got out of the car. Now, right away, this is something that obviously most of us would think is not a good idea to do. That can escalate the situation very quickly. A law enforcement officer that is not trained is probably going to react to this with some sort of show of force or think that maybe the driver is going to threaten them. But in this case, because the officer had some knowledge and training about autism, he identified that maybe this driver was a little bit different. So he approached the driver calmly. And then basically the driver was just in his own driveway. So the mother came out and they all had a conversation, and really didn't end in a citation or an arrest, because the officer was able to talk to that person and just understand that the situation was not what he thought it was initially. Unfortunately, there are a lot of examples where this situation has gone badly for many folks, not just those that are autistic, but other minorities as well. And really, again, this requires the professional to take a moment, take a step back, and really lean on the tools in their toolbox to identify and say, is this person a threat to me? Or maybe they're just not typical. Maybe I need to think about this for a second. This is another scenario, again, just ripped from the headlines as far as an actual news story. There is a police officer that was responding to a family dispute. Basically, the mother was concerned that her son was essentially in crisis or getting upset, and so she called for assistance. I know in a lot of communities, there is obviously a big push to not have law enforcement respond to these type of situations, to have some other kind of trained professional, crisis counselor, mental health professional to respond to these situations first. But in this case, it was a law enforcement officer that was called. But when he arrived, he was waiting for the crisis team as well. So he basically just observed his surroundings and found common ground with that individual. He noticed that there were musical instruments in the room. And so he picked up one of the instruments, the individual picked up one of the instruments, and basically they just started playing music together. And that was all it took to de-escalate the situation. Instead of coming into that scenario and escalating or having to show force or upsetting that person, he connected with them on a human level. And as the mom shares, that individual calmed down and didn't need any other intervention. And again, unfortunately, we see over and over again that these situations don't always end up this way. When things get escalated, things can get violent, folks can get arrested or worse. And training can really help with just allowing that officer to feel comfortable taking a step back. And that's really all it is. At the end of the day, if that individual was violent or was a threat to others or needed additional escalation, then of course that protocol has to be followed. But in many cases, it's really just taking a step back and doing what you can to de-escalate or to communicate in a different way, and don't jump to conclusions. And unfortunately, when you only have a few seconds to make decisions, that can be hard to do, but the training helps with that. So training that first responders or law enforcement officers should be taking should cover how to recognize the signs that somebody might be autistic or might have other needs or sensory sensitivities, how to approach those individuals, and how to communicate. So different tactics that they can use to provide instruction or to communicate and understand what's going on with that individual. Also some common safety needs and tips, again, being aware of elopement and strategies and what to do in those cases, or maybe even just advice on how to administer care to that individual if they are a first responder, for example, while still keeping in mind that that individual needs to be treated differently than someone who doesn't have sensory sensitivities or those differences. Training should cover also how to provide medical care or treatment, how to assist in an emergency, how do you balance the need to get that person out of that situation or get them the medical care they need without actually making it worse. So there are some physical differences, some actual medical differences in how you would treat someone who's on the autism spectrum versus a neurotypical person. And there's also, again, communication and essentially bedside manner, not going up and touching someone right away, letting them know what you're doing, explaining what you're doing. And also just knowing that when they communicate with you, they might have some other differences that can really make that interaction be a positive one, and you can get your job done at the end of the day. It should also review ways to help individuals with multiple needs or differences. Again, someone might have a mental health concern, but they're also autistic, or they might have other differences in addition to autism. So just, again, having the knowledge and being aware that those folks have a lot of different things going on. And really, at the end of the day, we're all individuals. So we should treat everyone as such and not just with stereotypes or kind of painting everybody with a broad brush and how you're going to treat them. It also should be updated and re-reviewed periodically. So a lot of the departments that at least I've seen, first responders and law enforcement, looking at this, they may have a one-time training, they may do a special event, they may carry something in their cars that is supposed to help individuals that are autistic, but it's really something that needs to be an ongoing commitment. They need to do ongoing professional development. It needs to be updated content, and they need to re-review it to remind themselves about the best practices and also get new information. So we don't want it to be a one-time thing. This needs to be an ongoing commitment. I will say that there seems to be a bigger focus in law enforcement as far as trying to provide additional training, especially when we talk about, again, the events of the last couple of years, trying to provide better management for mental health situations, trying to provide other supports and understandings to de-escalate situations. First responders, there's definitely a need there, and my organization has worked with quite a few across the country, but there's still, from a medical perspective, needs to be more awareness from a medical professional standpoint, understanding that they need to do additional training specific to this. Individuals that are autistic are 8 times more likely to visit an ER or urgent care clinic, and less than 1% of those locations have any kind of autism training. So again, they're great at what they do for those specific interventions, and an emergency is an emergency, but you need to treat that patient and meet them where they're at. Also, training should include multiple perspectives. And so again, if you're an advocate in this space, or maybe you're autistic yourself, you already know this, but we don't just want to have perspectives of experts or even parents. We want the perspectives of those self-advocates, of the folks that live this day to day. And within autism specifically, of course, there's a wide variety of strengths and challenges, but we want to make sure that we are elevating the voices of those that are actually living that experience. So in the program that IBCCS provides, we of course do that, and we have autistic adults sharing the information, sharing their viewpoints. But any program that a department undertakes, I do think that that needs to be at the forefront of making sure that it's a well-rounded program that's really going to benefit that organization. So what can you do? So as a community member, you might, have a job, or might have connections with folks in the community, or you might just feel like, well, I'm just, one of a million, I'm in a sea of voices. But departments and organizations do listen to you. They listen to their constituents, they listen to their community members. And a lot of times it's just educating them that this is out there and there are options and there is a need. And it can really just open their eyes with just a little bit of information. So reach out to your local first responders and law enforcement. Just call them up, send them an email, go to their website, go to an event, and just let them know, I live here and I think this is important. What are you doing about it? Most departments have annual or biannual crisis intervention training, which basically covers a lot of different topics. It's important, again, to emphasize that they need autism specific training so that they can be more knowledgeable in this area, which is a huge area of need, but isn't typically covered, or if it is, it's very, very brief. Reach out to your local decision makers, your city commissioners, your city council, your local politicians, community leaders. Most of them probably want to do what's best for the community, but they may not be aware that this is an option or a need. And again, education is key. If they have a personal connection or they have experience in this area, then obviously they should probably be pushing for this already. But again, taking a step back and looking at folks who just aren't aware, or maybe they have a very surface level knowledge of what autism is or what it entails, what those needs are. Maybe they've only seen it in TV or movies. This is an opportunity to educate them and not only make your voice heard, but again, open their eyes to the number of individuals that this impacts, and that there are options available, and that you as a community member want this to be a focus. There typically is already funding set aside for training. Every department, every organization has to do training. They do training every year. So this just needs to be included as part of that. So if the answer is we don't have the funding, there is funding. They just have to allocate it. They have to figure out a way in their budget to make it work, just like we have to balance our own checkbooks. And then also some cases in some departments, they've also gotten grants or a corporate partner to sponsor the training and certification if it wasn't in their budget. There's avenues that they can pursue to get this approved. And again, if you're working with decision makers, if you're working with those organizations, it might take a little bit of time, but they're doing training anyway. They're looking at crisis intervention. They're looking at ways to improve the relationship with the community. They're looking at ways to de-escalate situations and avoid negative scenarios in most cases. So they just need to be educated on the avenues they have available to them, and that this is a need, and that what they're doing probably isn't enough. Again, my organization works with lots of departments and organizations, first responders around the US. So there are some cities and departments and communities that are already focusing on this pretty heavily. But I would say in general, most are not doing enough. And again, it can't just be a one-time thing. It needs to be ongoing. So there is a training budget So again, you can bring that up, and you can also talk about, if there is a corporate partner that would sponsor the training, that's great for a public-private partnership in some cases to be formed, because of course it's a great thing for everybody in the community, or at least, a large percentage. And it's just a great cause to get behind from a corporate perspective. So sometimes some departments have sought out that partnership as well. And then make sure you're sharing helpful information. So if you do have personal experience in this area, whether you're an autistic self-advocate, or maybe you are the caregiver or parent of someone who's on the spectrum, raise your voice. I mean, sometimes it's a lot of burden to be put on one person. It can seemingly feel like it's you trying to educate the world, but it can be helpful to not only just tell them that this is what you want, but to share things that have helped you, to make those connections in your local community, to share your story, to share tips that maybe have helped from your experience. Especially if you're an autistic person that does have the ability to do that, it can be really impactful. So make sure to be open and honest and share that feedback, share any tips that you have, or things that maybe other communities have done that you think would be helpful to implement. There's lots of information on the internet, obviously, but you're the best advocate, and you can speak from experience. And if you're not personally connected to that, but you want to be an advocate, again, you can share information like I shared in this presentation. You can go online. There are a lot of options and resources. So sometimes it can start with sort of a simple education campaign on what is helpful for them to do, in addition to training, which is critical, but also a few other, changes they can make to their policies, or other organizations, or ways that they can connect and provide support. So that's the end of my presentation. Again, I hope that helped empower you and give you some ideas and talking points for working in your communities, for advocating for these needs. I do see a shift in the last year or two with more of a focus on these types of things, but it's still something that needs a lot more attention in our communities. And it starts with you and me and everybody coming together and educating and sharing that this is available. Again, there are lots of options for training, but making sure that it's a quality program that is also something that is ongoing professional development is really critical. So if you have any questions, my information is here on the screen. You can feel free to email me at meredith@ibccs.org. And good luck, and thank you so much.